Hey everyone, welcome back to the PIMD podcast. I'm Dr. Peter Kim, and today we're diving into something that could change the way you look at your career and income. Like I've spent years, even decades, mastering medicine and learning so much. Is this the only way to use all of that knowledge? If you ever thought that, you're not alone. And this episode is for you. Like we're going to talk all about how to earn more with what you already know. So if that sounds interesting to you, stay tuned. Welcome to the Passive Income MD podcast, where we talk about creating your ideal life through multiple streams of income. If you enjoy hearing about this stuff, make sure to hit subscribe. Now let's get on with the show. Hey everyone, hope you've had a great week. It's funny, when I'm recording this right now, man, the rain is pelting outside. I live in Southern California, so that's pretty unique for us. It was a beautiful day. It was 70 degrees. And then I come in here to record and it just starts pouring. And I think that's a funny metaphor for life, because sometimes life is going one way and you think it's going to be one way and turn out another way. And then you walk somewhere else and it completely changes overnight. And so for some people, they thought their career was going to be one way, and they've reached a point where they're thinking, what else is there in terms of what else can I do to leverage what I already have to maybe create something new, to bring on something new and try something different. Now, I'm not talking about working more shifts or seeing more patients. When I talk about leveraging your existing medical expertise or knowledge, I'm talking about different, new, powerful ways to leverage that, to do different things. Now I absolutely believe that pretty much all of us went into medicine for the right reasons, because we wanted to help people. It was going to be meaningful. We were going to have a great life. We wanted to make a difference. We wanted to use our gifts in a meaningful way. And I know we still get to do that every day, but let's be real. Today's healthcare system, it wasn't designed for physician fulfillment. We're buried in our EMR, spending time on that, charting, or chasing these RVU numbers. Many of you are working these crazy shifts and doing long weeks while missing birthdays or family dinners or just downtime to do something fun. And I know people are telling us we shouldn't complain because we're high earners. Many of us still feel stuck, both financially, professionally, emotionally. But here's something that I think many of us absolutely forget, like your expertise, the decades of education, training, real life experience that you've gathered over time. It's way more valuable than you think. And it can be used to generate income and create a life outside the clinic or hospital. Let's talk about a few ways how. Number one, medical consulting. You get to share what you know. This is one of the most underappreciated and accessible path to leverage your medical knowledge. And that's just medical consulting. Like there are health tech companies, those are popping up all over the place. Digital health startups, some pharma companies, legal teams even. They're all looking for physicians to bring clinical insight to their products and strategies. Like you might be able to help design a digital health app. That'd be a lot of fun. You'd be able to review clinical protocols, and I think that's important for people. You can consult on user experience or patient experience. Sometimes you can offer feedback on patient or customer educational materials. And the best part is you don't need this to be a full-time thing. A few hours a month can turn into thousands of dollars a year. I've seen it happen to so many members of our community. It can open up a whole new network and income stream for you. A lot of the stuff you do, it's just common sense, right? At this point. But for other people, it isn't. That's exactly why they need you. You live and breathe medicine every day, and those companies don't. Number two, you could start a side business in like a health space or health adjacent space. Like if you ever thought there's a better way to do this, you might be ready to start your own thing. You could start a telehealth clinic focused on a very specific population. You could create an app or a way to use data to better serve certain populations and improve patient outcomes. You could create a brand that solves a problem. Maybe it's a product or a piece of education. Like you already know the gaps. You've seen the pain points. You probably think about it and you just let it float by. That insider perspective that you have gives you a huge edge in building something that actually works, that people will pay for, that people will benefit from. So I tell people, don't wait for someone else to create it. If you've thought of that idea and it's come up in your head several times, it might be best if you lead it. Just think about that. Number three, you could serve on a board or be an expert advisor. Now, I think this is a real gem. We've already talked about startups, especially in med tech and digital health, which is absolutely exploding. They're looking for physicians, not just to consult, but to actually sit on their advisory boards or offer strategic guidance, be part of the team to begin with. Like, I don't think you don't need an MBA for this type of stuff. You just need your ability to think clinically, ask good questions, and speak the language of medicine, which you do every day. These roles can come with stipends. They can come with those fees like consultants, but they can even come with equity in some cases. Like you get a seat at the table where you can shape the future of medicine, how healthcare evolves. I mean, I think that'd be fun in addition to potentially lucrative if you do it right. Hey everyone, this is Peter Kim. I've got some exciting news for those of you thinking about taking your career beyond clinical medicine. PIMDCON 2025 is officially happening this September 25th through 27th in Newport Beach, California. Now, this isn't your typical conference. It's designed specifically for physicians like you, those who are exploring side hustles, thinking about starting a business, or wanting to learn how to invest in passive real estate. Now, at PIMDCON, you'll hear from top experts, investors, and entrepreneurs who've been in your shoes and are ready to share what works. Now, we built this event with you in mind, with tailored tracks focusing on real estate investing as well as entrepreneurship. So whether you're just starting out or looking to scale, there's something here for you. And if you can't join us in person, we've made it easy for you to participate virtually from anywhere. Now, if you've been thinking about creating more freedom in your life, financially or professionally or time, now this is your chance to take the next step. So head over to PIMDCon.com to grab your ticket. I hope to see you in Newport Beach. It's going to be an incredible weekend of learning, connection, and inspiration. So I know what you might be thinking, like, this sounds awesome. This sounds great, but where do I even find those opportunities and get started? So I have 3 practical steps for you. Number 1, network intentionally. You tell your peers and the communities and the networks you're in, especially when you go to conferences, what you're interested in. Like you attend events where physician entrepreneurs hang out. There are plenty of those, even like PIMDCon in our conference, if you wanted to come. Like a single conversation, you never know where it leads to. It can unlock massive opportunities. I know it's happened for a lot of members in our community. Number 2, use LinkedIn as more than a resume. In fact, a lot of physicians don't use LinkedIn, but if you update your profile, follow companies you admire, you comment on posts, you talk about a certain expertise, you claim that this is what you're looking for, you create visibility for yourself, and that leads to connections. You never know where those connections will lead. It can lead to opportunities just in this space. And next, just talk to someone who is doing what you want to do. Think about it. Doctors are some of the most welcoming people to other doctors. If someone else reached out to you and said, hey, I want to ask you something about this, wouldn't you give them some time? I mean, there are physicians out there who are consulting or part of advisory boards or have equity or startups. You'd be surprised the doors that can be open if you simply just reach out to them and message them, whether it's on LinkedIn, social media, whatever it might be. Maybe they're colleagues or somebody that you know of or somebody in a community where they're doing something that you want to do. Maybe they're building businesses or advising, whatever it is. The thing I've learned is that most people are happy to share. When they're excited about something and they do it, they want to share it with other people. And they probably ask someone else, so they just want to pay it forward. You'd be surprised. So you're not behind. You're just at the beginning of this. So you got to just go out and ask. And I find that the real barrier, it's not that you don't have the knowledge. You absolutely do. You have the knowledge, you have the training, you have the perspective, you have the experience. But what holds most of us back, it isn't this capability thing. It's like fear of the unknown. It's fear of being seen as like an imposter, of not knowing what to say, of not knowing where to start. But again, let me remind you, you've done some of the hardest work in the world to get where you're at and what you do daily. Like you survived all of these things to get where you're at, sometimes with a lot of uncertainty. You didn't know where you would end up, but you did it anyways. So then you're more than equipped to take this next step. Like you don't have to quit medicine either. You just have to expand how you use your expertise. And that's what the cool thing is. So what's one step that you can take this week? Maybe it's reaching out to someone on LinkedIn. Maybe it's just brainstorming a business idea, putting it on paper. Maybe it's applying to speak at a conference or an event or joining a community. Now, we have many like that you could join, like the Leverage and Growth Accelerators, where we have a community of hundreds of physician entrepreneurs and real estate investors talking about this stuff all the time. You can always check that out, but just take one step. And that's how it starts. Because the life that you want, the income that you want, the impact that you want to make, it's all possible when you start using your expertise differently. So I hope this episode has helped give you some ideas, that it sparked something in you. I'd say keep going, make it happen, and let's talk again soon. Thanks, everyone. Enjoy the show? Let me know by dropping a review in the podcast app you're listening to us in. And if you haven't already, make sure to hit subscribe. Join thousands of physicians who are also on this journey to creating their ideal lives through multiple streams of income. Learn more at our website, passiveincomemd.com. Thanks again for allowing me to be a part of your journey. See you next time.